Hello and welcome to this Facebook Live event brought to you by the American Diabetes Association and the National Eye Institute's National Eye Health Education Program. I'm Andrea Roan, news anchor for WUSA 9 in Washington, D.C., and moderator for today's event. This afternoon, we'll be discussing how people with diabetes can protect their sight. Joining me are our two experts, Sasha Uhlman from the American Diabetes Association and Dr. Emily Chu from the National Eye Institute. Ms. Uhlman and Dr. Chu will talk about how diabetes affects eye health, what diabetic eye disease is, and who is affected, how people with diabetes can prevent vision loss from diabetic eye disease, and the latest research on the treatment of diabetic eye disease. Before we get started, let's learn a little bit about our experts and their organizations. Ms. Uhlman is a registered dietitian and certified diabetes educator and serves as the American Diabetes Association's Director of Nutrition. She has facilitated type 1 and type 2 diabetes education classes and is a certified insulin pump trainer on 4 brands of insulin pumps, as well as both continuous glucose monitors. In response to patient requests, Ms. Uhlman founded and facilitated the Type 1 support group at the University of Michigan. There she also implemented a dietitian-led CDC diabetes prevention program and worked with local insurers to pilot reimbursement for the program. As the American Diabetes Association's Director of Nutrition, she is able to help provide underserved people with reasonable, affordable access and education for healthy living. The American Diabetes Association funds research to prevent, cure, and manage diabetes. The association also delivers services to hundreds of communities, provides objective and credible information, and gives voice to those denied their rights because of diabetes. Dr. Emily Chu is an ophthalmologist who specializes in treating retinal diseases. She serves as the Deputy Director of the Division of Epidemiology and Clinical Applications at the National Eye Institute, which is part of the U.S. government's National Institutes of Health. She is also the Chief of the Clinical Trials Branch. Dr. Chu helps to test treatments for diabetic eye disease and other chronic eye diseases. In addition to pursuing research, she examines and treats patients with eye diseases at the National Eye Institute. Dr. Chu is here on behalf of the National Eye Health Education Program, a National Eye Institute initiative. The goal of the National Eye Health Education Program is to ensure that vision is a public health priority through the translation of eye and vision research into public and professional education programs. NEHEP emphasizes the importance of early detection and treatment of eye disease and the benefits of vision rehabilitation. NEHEP also does great work in the community. My Links chapter, the Metropolitan DC chapter, has partnered with NEHEP and is piloting Right the Vision, Make Your Plan to Protect Your Sight program to educate African Americans about the importance of eye health. This event is scheduled to run about an hour and we'll be taking questions from viewers throughout the discussion. So if you have a question for our experts today, feel free to post it as a comment and we will do our best to answer it. Now, let's get started. What is diabetes? Well, it's a disease in which the body does not make enough insulin or can't use its own insulin as well as it should. The body uses insulin to help glucose or sugar get into the cells in our bodies. Without enough insulin, glucose builds up in the blood and causes serious health complications. Many people are familiar with type 1 and type 2 diabetes. Our Facebook Live discussion today is applicable to all people with diabetes. So let's get started with our first question. And I thank you both, Sasha and Emily, for being here with us. Many people have diabetes and don't even know it. About 8 million adults fit into that category. So our biggest question is, what are the common symptoms of diabetes?
So the common symptoms can be blurry vision, frequent urination, but most people have very few symptoms at all. Diabetes comes on very gradually, and so generally people may feel they're just getting older, they're feeling more tired, just more tired and tire easily, need more sleep.
Mm-hmm. And so how do you manage your diabetes, especially if you're not even sure that you have this condition?
So one of the keys is getting regular doctor appointments, making sure to get tested for diabetes, going to the doctor once a year, getting a blood test. Managing diabetes also involves a lot of the things is in general about staying healthy, making healthy food choices, staying active, moving more, as well as stress management can play a big role in asking your doctor questions. When you go to the doctor, make sure to ask lots of questions because you drive your healthcare.
I always say take a notebook with your questions so that you can have them, and if you forget something, you can refer to that notebook. What we're talking about sounds like lifestyle changes that are important to keep us free from all diseases. Absolutely.
Maintaining a healthy body weight, losing just 5 to 7% of your body weight can help prevent diabetes. And that's only about 10 to 15 pounds for a lot of people.
Emily, talk more about the eye health complications that could result from diabetes.
So like many of the health conditions that can occur from diabetes, eye complications are very serious. But they also include having cataracts, glaucoma, or diabetic retinopathy. And mainly it's diabetic retinopathy, that's what we refer to in terms of diabetic eye disease.
Now, from a nutritional standpoint, how do we minimize our risk for eye health complications? It sounds like we go back to diet, what we put inside our body.
Absolutely. Filling half your plate with non-starchy vegetables, getting a lot of those leafy green vegetables, lean meats and protein sources, eating fish twice a week, which we'll talk about later, as well as whole grains.
What specifically is eye disease, diabetic eye disease?
So diabetic eye disease really refers to diabetic retinopathy. The retina is really the back of the eye that sees well and is nourished by blood vessels. As you just heard, blood sugar gets too high, the blood vessels get damaged. And when that damage occurs, several things can happen. It can cause the tissues that are there to swell up and doesn't work very well. So we have what we call swelling of the retina, macular edema. We also have the blood vessels actually dying because they're no longer functioning. And so the retina is not nourished anymore. And like anything else in the body tries to take care of it by developing new blood vessels. So those are the main features of diabetic retinopathy.
So we have 29 million people who are diagnosed with diabetes. How common is this? The majority of them at risk for diabetic retinopathy?
Well, at least 8 million people probably have diabetic retinopathy or more. About 40% might have some form of diabetic retinopathy, and that's going to just increase over time. You know, by 2030, we expect 11 million people in the U.S. to actually have diabetic eye disease. And by 2050, you're going to double it almost by 15 million. So there's a huge number that's going to come up with diabetic eye disease.
Why are we going to have this huge number if we're talking about ways to prevent and early detection?
Well, part of it is because people are living longer, and we're increasing. You know, it's an aging population, and age is one of the risk factors for diabetes. And so I think all those add in factor that we will have more people with diabetic eye disease.
And this includes those who are type 1 and type 2 diabetics?
Both. That's right, because type 1 and type 2 get similar eye disease.
Now, I know there are 4 stages of diabetic retinopathy. Dr. Chu, if you could take us through that.
Sure. The 4 stages we talk about are really varying degrees of the blood vessel damage. So it can be very mild, and then the blood vessel damage can be even moderate or even very severe. But when it becomes a very end stage, that's when new blood vessels actually grow. So it's called the proliferative disease. And the first 3 are called non-proliferative, mild, moderate, and non-proliferative. And in those cases, you may not have any symptoms unless you have what we call the macular edema, the swelling of the retina. They're not seeing very well. So you can have very severe disease and not even know it. So.
Take us again through the 4 stages and the symptoms. Are they very different at each of the stages?
They can be very different. And for each stage, when it's mild, really nothing much happens unless you have what we call swelling of the retina. It's not till the very severe stage when you get the blood vessels develop, you get signs of floaters in your eye, you may have blurry vision, and to some extent you may have a big bleed in the eye, and that can really block the vision off, and that can cause very severe vision loss. So these are varying degrees of, again, the severity of the retinopathy will also predict how well you're going to see or not.
Who is at greater risk for diabetic retinopathy?
Well, those who are at the highest blood sugar levels. So if you can control, as Sasha says, you know, it's important to eat well, have a good lifestyle, healthy lifestyle, even when you have diabetes, because that really prevents you from having eye disease. So high blood sugar, people who are pregnant, for example, is also at risk.
Why is that?
So what happens is that when they're diabetic and are pregnant, you tend to help get them in better control of blood sugars. And quite often they drop their blood sugars very rapidly. And when that happens, it can trigger some changes in your eye. And that's true of people who are not even pregnant, who are trying to get into, say, an insulin pump that's, dramatically drops their sugar levels very rapidly. So that can happen. And people who are African American and Latinos have a slightly higher risk of that, and partly because they have also higher blood sugars more than anything else.
Does family history play a role in this as well?
There is hereditary aspect to this, and we know that diabetic eye disease have some genetic predisposition. There's some relative relationship. We don't know the exact role of the genes, but we do see family patterns of that for sure.
So we talked a little bit about lifestyle changes in diet, but how can people living with diabetes right now prevent vision loss from diabetic eye disease?
Well, vision loss, I think number one thing they could do, well, in addition to the healthy lifestyle that Sasha talks about, is to have an eye exam. So all the stages I talked about, even the very severe stage, you may still be 20/20 because the blood vessels have not burst. They haven't, caused the catastrophic change that you might see. So you really want to detect them early so you can treat them. So early detection is very important for the eye disease. So a regular eye exam, at least once a year, is very important. A comprehensive eye exam is extremely important for preventing diabetic eye disease.
Now, I'm nearsighted and have been with that condition since I was 14, so I go in for regular eye exams. Is my eye exam the same, a comprehensive eye exam, as someone who has diabetes or suspect they may be pre-diabetic?
It may very well be, but the one thing to look for is that they should check your vision to see how well you're seeing. They put drops in to check the pressure of your eye, looking for glaucoma. And the third most important thing is putting drops in to make your pupils very wide. And the reason you know they're wide is because you can't read very well. So they really paralyze your ability to read. So that dilated eye exam allows the doctor to look in the retina and see changes that they can treat. And as I say, even the most severe disease can be picked up because they had no symptoms. So that's the number one thing, is having a dilated eye exam.
And Sasha, we were talking again about anything we can do to prevent this, and again, lifestyle and diet, those things that we should include or exclude.
Sure. One of the ways I describe having high blood sugars is what we're trying to avoid, whether you have type 1 or type 2 diabetes, is your blood sugars when they're high are more the consistency of maybe molasses. And if you think of diabetes affecting all your blood vessels, try sipping molasses through a straw. It's really hard to do, right?
Ooh, yeah.
And your blood needs to be the consistency of maybe orange juice. You can't see through it. There's a little clumps in it, maybe if you think of regular squeezed orange juice, but it's going to flow smoothly. And so one of the goals of managing diabetes is checking your blood sugar regularly, whether it's with the physician at the doctor's office or if you're self-monitoring at home, and knowing how food affects your blood sugar. So making healthy choices is going to be different for everybody with diabetes. So including lots of non-starchy vegetables, filling half your plate, watching your portion size to maintain your body weight. Those are all ways that help.
When I was asking about who's at greatest risk, does it differ with someone who is taking insulin to manage their diabetes versus someone who is non-insulin dependent?
So the people with insulin tend to be a little more severe in their diabetes. We actually tend to see more diabetic eye disease in that group, because not so much because of the insulin, because of the severity of their disease more than anything else. They tend to have a longer duration of diabetes, so that's another risk factor. The longer that you have diabetes, the more likely chance you might get diabetic eye disease as well. So.
We've gone through the stages and the symptoms. What about the treatment of diabetic retinopathy, and is it a condition that can be cured?
Well, curing eye disease would be like curing diabetes itself. So we don't have a cure. As long as you have diabetes, there is always the risk of diabetic eye disease. And the treatments, we've done many decades now of research on diabetic eye disease, and we've come a long way. And it's 95% treatable in terms of preventing vision loss. So it's quite highly effective in many ways. The key is making sure you get seen, you're being screened in a timely fashion to get the treatment. So,
what does it mean if the treatment does not improve your vision, though?
So the treatments that we have, and there are a number of them now, and I should probably talk a little bit about the types of treatment and whether they improve vision or not. So we used to have laser for many, many decades. Laser has been a very important part of our treatment. Lasers are bringing burns in the eye. It sounds painful, and it's actually bright light that flashes in the retina. It converts into heat, and it actually does some damage, but it actually helps the eye. And by doing so, we reduce vision loss by 95%, as I said. But doesn't always improve vision, and especially it's given for what we call diabetic macular edema. It may prevent you from more vision loss, but doesn't always improve it. But more recently, in the last decade, we've been really blessed with some incredible drugs. You all heard of Avastin, which is used for colon cancer. So we decided to look at it for the eye, and one of the drug companies, several drug companies have worked on this. And this drug is usually meant for cancer, but there's 3 different types that we have now. It's called Lucentis, or Eylea, or Avastin. So all 3 drugs are introduced into the eye by needle, and that sounds painful,
yes,
but
it does.
but it's been an incredible milestone because people now can improve their vision. So it's not unusual for them to improve their vision with these treatments, and that has really been a big treatment. We also inject steroids, corticosteroids, when it doesn't work with the other 3 drugs I call the cancer drug or anti-VEGF therapies. We then have steroids to use, and when it becomes very, very severe, there's scarring in the retina. We introduce very small micro instruments called a vitrectomy, and we go in under microscope and remove the blood, the scarring, and that has been very helpful as well for bringing patients back their vision. And those are very severe diseases that we're talking about, but there's very few cases where we really cannot help anymore. So I think that's the important aspect. Again, it goes back to early detection. Yes. You want to get to the point where you can prevent it with the good diet and prevention of really good blood sugar. Failing that, blood pressure is also important. People with high blood pressure have a higher risk of a diabetic eye disease, and then cholesterol. So again, it's part of the diet, and part of the treatment. Most people are on some sort of cholesterol-lowering drug. Cholesterol also increases the risk. If the higher cholesterol is in the blood, it's like the molasses. It makes it kind of sluggish, I'm sure, and it causes more damage. So all those things are very important.
And we do want to get a control of this because we're no longer talking about adults. Every day we're reading stories talking about the number of children and adolescents who are type 2 diabetics, which means some can be obese, some are not moving the way they should, their diet is not important, and they too are at risk for diabetic retinopathy?
They definitely are. Anyone who gets diabetes are at risk for diabetic retinopathy.
You talked about the treatments and where we've come as far as drugs. It seems as if we really have come leaps and bounds from when diabetes first came into the vocabulary. How far? Really, how far?
I think we've come very far. It was in the 70s when the lasers were actually tested. The National Eye Institute started in the 1970s with the first study that was ever done in ophthalmology, basically, and it proved that laser is very effective for diabetic eye disease. But before that, if you came in, you have that proliferative disease or new blood vessels, 50% were blind in 5 years. And, my colleagues from that era says that their clinic was filled with seeing eye dogs. We never see that anymore. So we've come a long way. People are driving. People are doing much more. The vision loss has been really helped dramatically. I mean, it's really 95% reduction in very severe vision loss. So we've come a long way. The research has been very important. I think research has to continue. That's how we move forward. Exactly. I think we've done so with diabetic retinopathy.
Everybody's talking about genomics. What about the role that genomics plays in treatment and prevention of diabetes?
I wish we had some good clinical tests for that. At this moment, we do know genes do matter. For example, we know that in families it does seem to have an issue, and when we look at diabetic retinopathy, it seems to be heritable, and we've looked at genes, but we don't have a gene that we specifically said, well, if we have that one, we can take a test and predict what's your course going to be. We're not there yet at that point, but maybe we will be someday. But right now, genomics doesn't have a huge role, at least in our treatment of diabetic eye disease, but it may in the future, so we're really studying that very carefully.
I was reading about technology that they're looking at as far as the future of diabetes and eye disease, and it was something called adoptive optics technology. Can you explain that and how it could be something that we'll be talking about in the future?
It sounds almost like really outer space work,
Yes.
but basically it is a bit like that. It's the Hubble telescope has those different mirrors and how you look at the telescope. That's why it's so great. Well, the cornea, the part of the front of the eye, has a lot of different rough edges. So in order to see in, you have to have different mirrors to look in, just like you do in a telescope that's way out in space. So we've developed that for the eye. You can look at each cell of the retina, the seeing cell of the retina, what we call photoreceptors. That's what you see with. You can actually image the cones, which you see color vision with, or the rods you use for nighttime. So it's quite dramatic. And you can also look at blood vessels in a different layer. But again, it's very experimental. We're looking at it, but it can be very powerful in the future for us to do more research and looking at what happens when you do certain treatment, what's the natural course of the disease. So that's a very big field that's being well funded and looking at very clearly.
We had mentioned before, is this a disease that can be cured? And right now you said there's no cure for diabetes, so definitely no cure for diabetic retinopathy. But there are transplants being performed that, or curing people of diabetes with pancreas and kidney transplants. Is that part of the future in curing diabetes?
I'm sure it may very well be. I think that's, again, curing diabetes and slowing down, the damage of the high blood sugars. The pancreas hopefully will be functioning and working. I mean, the ultimate goal is to replace that not working pancreas, which is where the insulin comes from. So that would be a very important step.
So if you replace that working pancreas, would that reverse someone who has the condition diabetic retinopathy?
No, this was done decades ago when they've done some just pancreas, replacements, and there seems to be some improvement, but once you have the very end stage, it's very hard. You cannot go back. So the retina is really brain tissue, so we don't have ways of really repairing it. So the damage is done, it's very tough. So you really want to get to the point where it's really, again, primary prevention before you get to that stage. So
we've been doing a lot of talking, but we do have some people on Facebook who are watching and they have questions for you. We want to go to Tracy first. She asks, what preventive health measures can I take for my eyes? I wear glasses and of course I am diabetic.
Well, I think the first thing is make sure you see your eye doctor once a year. I think that's very important, getting a dilated eye exam. And second is making sure your blood sugar is in a good control, because that really helps dramatically to prevent you getting eye disease. So those are the two main, the sugar control, again, the physical exercise, healthy living is very important. Controlling your blood pressure, controlling the cholesterol. So all those things that they medically can help with is very important.
We have Christian asking, just diagnosed with type 2 diabetes. This is all new. Is the eye dilation test important, and where can I get my test if my insurance doesn't cover it?
That's a tough one. That is a very tough one. And I just learned that even Medicare doesn't even always cover an eye exam. That's really appalling.
Now, even if you've been diagnosed with the condition, it may not cover the eye exam?
It may not cover it. So,
well, that's a catch-22 for you.
Yes, we need to up the game in getting some of this accessibility for people. And when you're diagnosed with type 2, we always recommend you have an eye exam right away, because we don't know how long you've had diabetes. It could be a number of years. And a third of them may actually end up with some diabetic eye disease. So it's very important with type 2s, because type 1 we know when you start, but type 2 you don't. So that eye exam is actually very important. How would you get to it? There are free eye clinics, I know about those. There are resources that they can go to and see whether they can get some help with it. But whatever they can do, get an eye exam. It's very important.
Yeah. And calling the American Diabetes Association to help with this advocacy, because this is something that we do, is help people advocate for the healthcare needs they have.
All right, that's important, Christian. Go to the American Diabetes Association website or call their office in your area and ask this very same question. We have another question from Anudra. I know I'm saying that incorrectly, but what are good protein sources for vegans with diabetes?
So for a vegan who is someone who doesn't have any, doesn't eat any animal products, good protein sources are going to be first and foremost beans and legumes, lentils, black beans, kidney beans, cannellini beans. Those are great protein sources, as well as high protein whole grain sources. Things like quinoa is a higher protein source as far as a grain, so you're getting more protein in that, as well as couscous, things like that.
So if you were challenged with vegetables, you've got to get over it.
Exactly.
And carrots do make a difference. They work.
Absolutely.
As far as eye disease, keeping your eyes, is that one of those good vegetables?
Carrots are a good vegetable, but I'll let
we always think about green leafy vegetables.
So that's what's
really important because it contains a source called lutein and zeaxanthin, and those are two type of vitamins that you use, and they're actually found in the back of your eyes. Wow. So it makes up a very important part of your eye. If you don't eat enough of it, it might be less. So we don't know its role, but we think it's important. But we know from some of our studies in other eye diseases that the green leafy vegetables play a really major role, as well as fish. So
things like spinach and kale
and collard greens. And what kinds of fish?
Fish, the better fish are going to be your fatty fish. So salmon, tuna, fortunately those are more popular fish. Trout, as well as sardines and mackerel.
Oh, okay.
Are some of the fattier fish that are better choices.
All right, very good. We have a question from Michelle on Facebook. She asks, is there pain associated with the progression of these diseases?
Fortunately, there is no pain, so that people don't even realize they have this problem. The only exception to this is unless they have very severe eye disease and they get end-stage glaucoma with it, but that's extremely rare. So pain is not an issue at all with this condition. It clearly is just blurry vision, vision, floaters coming in, and just not being able to see well enough, and sometimes night vision may be affected as well because the fact that we do lasers, we do treatments, and the disease causes the retina to kind of drop off in the areas that are really important for night vision, so the night vision may be a really big issue for some of these people.
And we have a question specifically for Sasha, I believe. Alfred is asking, how can we improve our diet so that we can mitigate our chances of diabetes? And we've gone over this, but I think it's important to stress because we think all vegetables, but as Emily was saying, the green leafy vegetables are important, and fatty fish. And what else can we do?
Absolutely. It's about what you choose, but also it's about how you eat. Making sure you're eating regular meals. For people who are skipping meals, it doesn't help you. Watching your calories and reducing the calorie intake, but getting those 3 meals in a day can be very helpful, because with diabetes, eating several times a day, maybe every 4 to 6 hours at the most, would be how long you'd want to go without eating.
Because if you're new to this and you could be overweight, you're thinking that if I don't eat anything, then I'm going to help my condition. But instead, you're really exacerbating the condition.
Yeah, perhaps because your blood sugar is changing all day long, and your body, you need those nutrients throughout the day.
And what kind of snacks? Because I've heard that you should eat like every 4 hours or 6 small meals. What are the good snacks that should be included?
So that's a great question, because a lot of the message out there may be to eat 6 small meals a day. And then when I work with people, they say, I feel like I'm eating all the time. They're trying to eat every couple hours. And so I definitely don't encourage that unless, you're eating very small meals. But for most of us, we want to sit down and eat a substantial meal. And so doing that, making sure it's a well-balanced meal. And if you need a snack, for example, a lot of people get up in the morning and go to work, then they have lunch probably at a regular time, but a lot of times there may be a big stretch throughout the day where they don't have a meal. Great snacks are going to be a small piece of fruit, something that's got high in fiber, maybe a handful of vegetables, or a small handful of nuts.
Are there fruits that can be too sugary that send you into a tizzy there?
It's more portion size. Okay. So there are some fruits that are known to be higher in sugar. Bananas tend to get a bad rap. It really depends on what else you're eating and your how you manage your diabetes. So half a banana may be a good recommendation for some people, depending on what else they're eating. Berries tend to be lower in carbohydrates. You get a little bit more bang for your buck. So it depends on how hungry you are and how often, how long it's been since you've eaten.
Sometimes you don't even know you're hungry until you start thinking about food. Then
Exactly.
all of a sudden I'm
That's right.
hungry. We have another question. Facebook watcher Denise was just there, and she was asking, what is the most important thing? We lost a little bit about your question. What is the most important thing I can do now that I have lost my eyesight to diabetic retinopathy? Emily.
Okay, well, I'm so sorry to hear that, Denise. That's really tough. That's not so easy. But there are still things you can do. I think you can still continue to keep a good diet because things can still progress. I don't know how bad it is, but one other thing you need to do is go to the low vision specialist. They really help for people who've lost vision because you may still have vision that they can work with and help you magnify or use what you've got. That's really important. And I think, there are also a lot of aids for managing your diabetes and aids for helping you to use whatever you can with it. It's a tough question. Now, the treatments, I'm sure you've exhausted the treatments. I want to make sure you've seen your doctors and talk to them and find out from them. We do have resources at the National Eye Institute. You can look at some of the links, especially for low vision. It's very important. And be sure that you have exhausted all the medical, I'm sure you have, but it's a very, very tough situation.
I think what you're saying, too, is it's still not hopeless.
Absolutely not
Things
hopeless.
are changing every day.
Exactly.
And who knows, that something could be there for her.
Yeah.
We have a question from Angie. If I have diabetes, how often should I have that comprehensive exam?
Well, we say you should have at least once a year. And there are people who might need it more often than that. If they have some degree of eye disease, diabetic eye disease, they may need to be seen every 4 months. So your eye care provider would tell you that, but at least once a year to detect any changes that we can help you with.
We talked about the 4 stages and the symptoms from 4 stages. We had someone asking us, and that's Adrian, can eye disease be reversed?
Can it be reversed? Well, that's a very good question. We're looking at that very question in some of the studies we're doing. And we talked about these drugs that we inject, these anti-cancer drugs that we're injecting in the eye, the anti-VEGF therapy. And we do see in some cases that there is some regression. In other words, they can improve a little bit, but you still have to get the treatments. So basically, again, it's the primary prevention with good diet, good glucose is very important. So the drugs may be able to help a little bit, but on the other hand, you still have to maintain that good blood pressure control, good sugar control, and your cholesterol. I think that's very important.
We have a question for Sasha talking about eye complications, but that's actually one of many complications again with this. Can you describe a few of the additional complications from diabetes?
Sure, and the complications are definitely, as we were talking about the blood and the blood vessels, I always think of that old molasses,
Yes.
example is when your blood sugar is high, that is increasing your risk of complications. So especially the things like your eyes and your kidneys both have these teeny tiny blood vessels, and so they're more likely to be damaged because if you think of the smaller the straw, the harder to get that through. Also, other things, diabetes can affect your skin, your skin, dry skin, things like that, as well as heart disease. So looking at your comprehensive medical exam to get everything checked out, again, your cholesterol, your blood pressure, you're more at risk of heart disease and stroke if you have diabetes, again, because of those blood vessels. Your heart's trying to pump that thick blood. So those are the other
your fingers and feet too. The
yes,
neuropathy.
and neuropathy, exactly.
Yeah.
Losing that sensation in your nerves.
Right.
I was telling you earlier before we went on Facebook that my mother is a type 2 diabetic, diagnosed about 10, 15 years ago. Her levels are such that she almost doesn't have diabetes because she does practice all of what you're talking about with early detection. She sees the podiatrist to see what's happening there, the eye doctor regularly, endocrinologist. Again, the early detection and the maintenance, keep making sure your drugs and your diet, all of it go hand in hand, can reduce your risk for developing some serious eye complications.
She's a model patient. We wish all our patients were like that.
But she'll be glad to hear that.
Yes.
She hates going to the doctor a lot of times, but she knows
yes.
how important it is. Yes. We have another question from Yvette, that she has lived with type 1 diabetes for 47 years. She has 2 vitrectomies, has had 2 vitrectomies. Dr. Chu, could you explain what that treatment is, and could you explain what that is?
Okay, so vitrectomy, I mentioned earlier, is a surgical procedure that's done to remove either blood that's in the eye for a long period of time, or the blood has gone away, but it left some scars. It actually can lift the retina. It can cause retinal detachments and all sorts of other things. So the vitrectomy that goes in to remove the blood, to clear the sort of optical pathway for the light to get in, so you can actually see it, and the scar, to remove the scar. So that is a very refined procedure done under the microscope and with very fine instruments that are introduced in the eye, and very skilled surgeons who do that. And that's for the very severe end stage of diabetic retinopathy. Right.
All right, and we have one final question, Nanette. Is there any research comparing eye dilation to digital retinal imaging when it comes to diagnosing eye disease?
That's a great question. So what Nanette's asking is that these cameras actually can take photographs without dilating the eyes, which is probably everybody would love to do, because dilation causes some problems. And how good is it? It's becoming pretty good. I mean, the cameras are doing very well. It doesn't replace an eye exam still. I just want to emphasize, you can screen for it, but it's so important for you to see the eye doctor, the eye care provider, to make sure you're getting all the information you need to have. It's getting comparable, but it doesn't replace that for care.
Are there any clinical trials? I know you're at NIH. Any clinical trials that our viewers on Facebook can get involved in, or that you need participants for?
Well, there's a Diabetic Retinopathy Clinical Research Network, which is, you can see from our website as well. This is a network that we set up, supported by the National Eye Institute, and it's 150 odd clinics throughout the whole country that are participating in these trials, and there are trials going on all the time. Absolutely, we would love to have anyone who's interested in clinical trials, and I think we learn so much from them, and they learn so much as well too.
We do. Well, we have learned a lot from both of you and from you who are watching. We are just about out of time, so again, I thank our 2 experts, Ms. Sasha Uhlman and Dr. Emily Chu, for joining us today. If you didn't get your question answered during the discussion, feel free to direct messages either to the American Diabetes Association or the NEHEP Facebook pages, and we will get back to you. And in case you joined us late, the video from this event will soon be available on both the American Diabetes Association and NEHEP Facebook pages. To get more information from the American Diabetes Association, visit diabetes.org or call 1-800-DIABETES. And to get more information from NEHEP, including tips on finding an eye care professional or financial assistance for eye care, and we did have a question about that, visit nei.nih.gov/diabetes. And a final reminder, remember to like both pages for news on research innovations in diabetes and eye health. I'm Andrea Roan. Thank you for joining us today.